Welcome to Enviromed, where better medicine is better business. We're going to introduce to you the allergiCare program, where we treat allergies, not symptoms. Now, how many times does a patient come to you and say, "I am so sick and tired of being sick and tired"? Do they try and avoid allergies however and whenever they can with limited success? You now have access to a brand new program that can help patients say goodbye to allergies for good. We call it allergiCare, the complete allergy diagnostic and therapy program specifically designed for primary care and urgent care markets. Now let's take a look at a normal allergy patient you might see in your practice every day. They might complain of the typical fatigue, migraines, otitis media conjunctivitis, rhinitis, postnasal drip, or strep throat. But what about internal issues like gastroenteritis, celiac disease, vomiting, or diarrhea? Maybe even upper respiratory issues like asthma, bronchitis, cough, sinusitis, laryngitis, wheezing, abnormal chest sounds, or upper respiratory infection. Maybe even external issues like dermatitis, hives, diaper rash, or eczema. How many times do you see this type of patient with these types of symptoms walk through your door every single day? If it's more than 2 or 3, you're going to love this program, because every single one of these symptoms is an ICD-9 code justifying the allergy program for your practice. Wouldn't it be nice to get rid of all these symptoms for these poor allergy patients for good? You bet it would. But right now, let's take a look at how you normally treat allergy patients. Typical therapy for this would be antihistamines, nasal decongestant, nasal steroid sprays, or a steroid shot. At this point, have you treated the allergy or the symptom? How do you know they're even allergic? You might forward them off to an allergy specialist, where as soon as that patient walks out the door, so does any additional revenue associated with that patient. You might even do all of these above. Well, here's a brand new novel idea for you. Why don't you start treating allergies and stop treating symptoms? How do I do that, you ask? That's where we come in. The allergiCare program is the first 1-2 punch in a complete therapy program for primary care. First, we start with the diagnostic piece, which is allergiTest. The allergiTest is a needle-free 72 antigen test kit used to identify what allergens are triggering allergy symptoms. The allergiTest will help provide avoidance measures to the allergens your patient tests positive to, and it'll also help determine next course of therapy options, such as medication or immunotherapy. At its simplest form, it'll at least confirm if a patient is allergic or not. It'll also help understand if allergiDrops are working by having a pre- and post-therapy test to compare. Now, the therapy side is the allergiDrops. allergiDrops is made of the top 100 allergy-causing antigens in the United States. Because of that, it is a universal and multi-regional formula that means national immunity for allergy triggers. Sublingual immunotherapy is a much more superior safety profile than allergy shots and allows a broad patient range, which means more patients can use allergiDrops than shots. That also means they're less expensive, more convenient, and more effective than shots and medication. Now here's a typical allergy test. As you can tell by the plastic applicator in my hand, it's completely needle-free and non-invasive. It is also safe to test. We don't use any food allergens in our mix. We only use environmental allergens. It's easy to do and easy to read, and the results are in 15 to 20 minutes. Now let's talk about reimbursement. Show me the money, right? Well, here it is. CPT code 95004 times 70 units. Now, depending on the state and depending on where the location in the state, your reimbursements may vary. Medicaid in the state of Florida is $3.33 per antigen, and there's 70 antigens on this test tray, which brings in a net of $233 per patient. For Medicare, it's $7.77 times 70, which is $5.39. As for average PPOs, it's anywhere between $4 to $7. So let's just throw $5 in there as an average times 70, so you're looking at least $350 or higher for reimbursement on PPO insurances. So now you have the capability to start your own allergiCare program in your practice right now. Help your patients, because allergies are no fun. Don't let allergies ruin your patients' picnics. Help stop the symptoms by treating the allergy. And start giving better care, providing better medicine, and doing better for your business with the EnviroMed allergiCare program. EnviroMed, where better medicine is better business. For more information, please join us at enviromed.com or call us at 800-779-4062.